In a harrowing escalation of Sudan's ongoing civil war, the Rapid Support Forces (RSF) paramilitary group has been accused of massacring at least 460 people at the Saudi Maternity Hospital in Fasher, the capital of North Darfur state. The attack, which occurred on October 26, 2025, involved the brutal killing of patients, medical staff, and civilians sheltering in the facility, marking the fourth assault on the hospital in a single month. This atrocity comes amid reports of over 2,000 civilians executed in the city over just 2 days following the RSF's seizure of Fasher, plunging the region into what UN officials describe as an even darker hell. The Saudi Maternity Hospital, the last partially functioning medical center in Fasher, had become a lifeline for thousands amid the siege that has gripped the city since May 2024. Witnesses and survivors report that RSF fighters stormed the building, executing individuals in cold blood, including those receiving treatment and heroic doctors who had remained to care for the wounded despite repeated bombardments. Some medical staff were abducted, further crippling any remaining healthcare services in the area. The World Health Organization, WHO, expressed profound horror, with Director General Tedros Adhanom Ghebreyesus condemning the killings and noting that this incident is part of 285 verified attacks on healthcare in Sudan since the conflict began. Sudan's military, which has been locked in a brutal power struggle with the RSF since April 2023, accused the paramilitaries of committing these mass killings as they consolidated control over Fasher on October 27, 2025. The city, a key stronghold for the Sudanese Armed Forces (SAF), and allied groups like the Joint Force of Armed Movements in Darfur, had endured a months-long siege characterized by indiscriminate shelling, airstrikes, and severe shortages of food, water, and medicine. The fall of Fasher represents a significant victory for the RSF, but at a devastating human cost, with residents reporting widespread atrocities including summary executions, looting, and sexual violence. The broader context of Sudan's conflict stems from tensions between SAF leader General Abdel Fattah al-Burhan and RSF commander Mohammed Hamdan Dagalo, Hemedti, which erupted into full-scale war after a failed transition to civilian rule following the 2019 ouster of longtime dictator Omar al-Bashir. Over 18 months of fighting have displaced more than 10 million people, killed tens of thousands, and pushed the country to the brink of famine. In Darfur, the RSF, descended from the notorious Janjaweed militias responsible for genocide in the early 2000s, has been accused of ethnic cleansing targeting non-Arab communities. International condemnation has been swift. The United Nations decried the world's failure to prevent the catastrophe, with senior officials warning of unchecked war crimes and crimes against humanity. Sudan's foreign ministry demanded accountability for the RSF, labeling the hospital massacre and civilian executions as blatant violations of international humanitarian law. The Sudan Doctors Network, a local advocacy group, echoed these calls, urging global intervention to protect remaining civilians and hold perpetrators responsible. As of October 31, 2025, the full extent of the death toll remains uncertain, with communication blackouts and restricted access hindering independent verification. However, satellite imagery and eyewitness accounts compiled by organizations like The Guardian suggest mounting evidence of RSF atrocities. Humanitarian aid groups including Médecins Sans Frontières, Doctors Without Borders, have suspended operations in the area due to safety concerns, exacerbating the crisis for survivors. This latest horror underscores the urgent need for renewed diplomatic efforts to enforce a ceasefire and facilitate aid delivery. As the international community grapples with multiple global crises, Sudan's forgotten war risks becoming one of history's most devastating humanitarian disasters unless decisive action is taken.